r/AskReddit by Reddit. Doctors of Reddit, what's the most incorrect patient self-diagnosis you've seen? Late to this, but my friend has an incredibly tough, alcoholic grandma. She ignored a stroke because she thought it was a hangover. Damn, that grandma must have had some rough hangovers. Late to reply, but my grandma toughed out 3 mini strokes because she thought they were migraines. Old ladies are tough. I personally knew a guy who was diagnosed with lung cancer in college at the age of 22. He was so young and lived a clean life, so it was confusing to everyone, even the doctors. They progressed very quickly with the treatment, and he was scheduled to start chemo. He was doing some sort of pre-diagnostic meeting, and an intern was involved. The intern started asking some very different questions, and he eventually asks the patient if he had been in Kansas recently. It turned out he had, in fact, spent the previous summer working in Kansas. This was a few weeks after. It turned out the intern had been writing a paper specifically about localized diseases, and there was this disease in Kansas that he had focused on. It had something to do with hay, but it wasn't hay fever. The intern was basically telling the doctor to humor him and run this one specific test. The doctor agrees, and the test comes back with results that show the intern was onto something. The patient went in for chemo treatments with a grim outlook, and he left with 10 pills he had to take over the next 5 days. 1 week later, he was completely fine. FWIW. This was in the year 2001. I'm not a doctor, but I'm a medical professional at a hospital. Patient came in stating that he had blood in his stool for almost a year and was convinced that it was just because of hemorrhoids. He only came in when he started to get abdominal pains. Turned out to be colorectal cancer. Moral of the story is, if you have blood in your stool, especially dark colored, don't ignore it. I had blood in my stool for around 6 months before going to the doctor. It wasn't in it, it was dripping, and like loads of clots when I wiped. The doctor didn't even do a rectal exam. He just had a look. He said I had a fissure. Also felt my abdomen, and was like, you're full of poo. Prescribed a stool softener, and after a few days it stopped happening. He also asked if I put anything up there as part of my sexual activities. A valid question, but still mortifying. I have had an unbelievable amount of patients who think they have Stevens-Johnson syndrome, thanks WebMD, when they in fact have contact dermatitis from new lotion or laundry soap. I also advise not looking up that condition. Edit: if you have recently started lamotrigine, carbamazepine, Bactrim, or allopurinol and develop a rash, definitely call your doctor. It may actually be SJS. For anyone curious, SJS basically makes your skin fall off 10/10 would not Google again. I'm not a doctor, but I'm a medical assistant. I did my preceptor at a kidney and hypertension center. Had a guy come in complaining of painful urination and thought he had a UT. Gave him a cup and told him to pee and set it in the window. The lab took the cup and immediately brought him back to a room. Which was strange, BC this place stayed packed, and it was all first come first serve kind of thing. Well, this guy went back, BC there was blood in his urine. A lot of it. This guy was beyond 300 pounds BTW. Just massive and extremely tall. Doctors got him in the room and stayed for maybe 15 minutes before we had him transferred to the ER. Apparently, he had a fractured penis and had no idea. The nurse above me said they lifted his gut and his entire groin was purple and black and his penis was at a weird, swollen angle. She said she'd never forget it for the rest of her life. The guy never did tell us what happened or anything. He acted just as surprised as everyone else. TLDR, UTI turned out to be a broken D. I would say after a couple years working in an emergency room before and during medical school, that by far the most common egregious self-misdiagnoses involved pregnancy. Tons of sexually active patients coming in complaining of morning sickness and gaining weight, and just sure they have some sort of GI issue or infectious disease. When it comes around to asking questions, oh yeah, come to think about it, I haven't had my period in 3,4,5 months. That's not to mention the people coming in fully in labor and delivering in the ED, truly shocked that they were pregnant at all. Now I understand people can have irregular periods and there are many cases where the patient is reasonable in not guessing what's going on, but there is a large group of patients who missed a lot of obvious hints. Denial ain't just a river in Egypt, I guess, and I do have empathy for patients in situations where they really don't want to be pregnant and so perhaps are subconsciously blocking it out of their mind. But a medical mystery it is not. I had a very nice gentleman come to the ED with severe weakness, going on 4 weeks. It all started with chest pain a couple of months earlier. He thought he was having heart trouble, and he knew you take aspirin for a heart attack. So he took a couple aspirin every day for the next few weeks. The pain got worse, and also started affecting his legs while walking. Then the weakness started. Then he pooped blood. A lot of it. That's what prompted the emergency department visit. When I checked his labs, his HGB was in the 4 range, which is low enough to make me raise my eyebrows. Normal is 13 to 15. You'll start feeling weak/tired around 10 usually. So his symptoms, including chest pain, weren't from heart trouble, they were from severe anemia. Turns out he had a small bleed from his colon, and taking aspirin, which thins your blood and makes you bleed more, turned it into a large bleed. So I get him tanked back up with blood. We do a few tests including a colonoscopy to see why he was bleeding in the first place, and whoops, we find locally advanced colon cancer. Thankfully it hadn't spread anywhere, so he eventually ends up getting surgery and chemo, and last I checked he's doing great. So this guy was incredibly lucky by misdiagnosing himself with coronary artery disease. He took a totally inappropriate medication, which caused a side effect that set off a chain reaction that led him to me and his diagnosis with cancer at an early enough stage to be cured. If he hadn't taken that aspirin, that cancer could have sat another year or 2 undetected and continued to spread, at which point it would have been incurable, and he'd likely be dead right now. When my husband was 8 years old he complained about having intense pains in his stomach and became so lethargic that he couldn't be woken up. His doctor said there was nothing wrong and that he had growing pains for 2 years. It turns out his gallbladder had stopped working and would only function correctly a few days out of the month. After the doctor refused him a referral to another doctor for a second opinion, his mom took him to the emergency room and within 15 minutes he was going into surgery to have his gallbladder removed. To top it off, they jam-packed him with so many pain meds that he became so constipated and he couldn't use the bathroom for 2 weeks. He complained about his stomach hurting again, and the nurses never once asked him when his last BM was, claiming that they forgot. He had to receive an additional surgery later that week in which he had 15 pounds of fecal matter removed from him. Talk about a pooey time. Not a doctor, but we had older man come into my ER with about 6 family members who all said he had some food lodged in his throat from dinner. He was able to communicate non-verbally and was able to breathe but not talk. Every single family member swore they could see it in his throat. We did a quick ridge. Blood pressure was a little funky but it usually is when patients first come in. Another nurse and I brought him back to a room, and as soon as we got him into the room his oxygen levels started to slowly drop. The doctor hurried in and prepped a scope to look down his throat. His oxygen dropped more and his BP started going up. The doctor quickly yelled that there was nothing in his throat. Literally the second she yelled it out he went into cardiac arrest. He had been having a heart attack the whole time. We did CPR for about 50 minutes, shocked him a couple times to get him in rhythm, but it was to no avail. He passed. Nephew of a nurse anesthetist who worked an emergency room in Portland for years. Of the many stories he has, this is my favorite. Gets a call to come to a bay by a doctor. Old guy is sitting on the examination table and the doctor says tell La what's wrong. Old guy explains he is having a heart attack, was sitting on a bar stool and boom. Terrible pain in my chest. He had walked to the hospital just a few blocks away. My uncle realizes the old guy is very drunk. Doctor motions for him to look at the old guy's back. There is the handle of a steak knife sticking out. The old guy is oblivious. Turns out some nemesis of the old guy saw him at the bar and stabbed him in the back. The pain he'd felt was the steak knife blade sticking in his sternum or between ribs etc. They got him in surgery and saved his life. As I recall he was not in terrible danger. It had somehow missed anything too vital. 28-year-old male who came in because he had a little pain in his testicles. He figured he caught it from his scrotum touching a toilet seat. On exam he had a scrotum that was the size of a grapefruit and extremely inflamed. Turned out it was epididymitis from 2 STDs. Worst part was that his mom and GF were in the room and he insisted they hear the diagnosis against our advice. We left to let him explain to them both how he contracted it from a toilet seat that also had a vagina. Thank you for watching Reddit. Don't forget to like and subscribe for more r/AskReddit videos. Share your stories in the comments section below.